Hello, everybody. Andrea Twarowski here with Dentalelle Tutoring. Once again, please excuse the mess. We are moving, and I don't have the best lighting in this room right now, so I apologize if it's kind of hard to see. But in the last video, I talked about new dental hygienists and what they should be asking for as their hourly rate starting off. And then that kind of led me to another topic of how to negotiate your hourly rate, because I find, and I do have experience with this because I was in the same office for about 10 years. I was a dental assistant, a dental receptionist, then a hygienist, and then a restorative hygienist also. And then we had moved, so I had left that office and I decided to actually temp. So I became a temp hygienist because I tutor full-time and I didn't want a full-time job and I didn't necessarily want a part-time job either. I wanted a job where I could pick and choose my own hours, work a lot one week, not work the next week, and not have to deal with, well, having to give 2 months notice for time off, having to deal with office politics, having to deal with weird staff members, who knows, right? The list can go on. So I actually became a temp hygienist, but this means for the first time ever, or I should say in like 10 years, I had to negotiate my hourly rate. I had to talk to offices about what my rate is and why it's that way. And I did even go on a few interviews also, and I hadn't done that for like 10 years. So I had to kind of learn how all of these things worked, right? And talking about money is always something that you want to be prepared for because you need to know how much people are making in your area. You have to realize, well, is that fair? Yes or no? And you have to realize too, well, how much should you be making based on experience? And, if it's not worth it to you, then you need to talk about upping your hourly rate, right? So, and with me, I do have a lot of experience. So I've been in the dental profession for about 13 years now. As a hygienist, I have about 5 years experience. I've been a restorative hygienist for 3 years. So my skill set is a little bit higher than your hygienist who has been working for 2 years. Plus I tutor, so I know a little bit more than your average hygienist also, because I do have to stay current literally every week to make sure that I'm not missing anything for my students. So I am able to explain things to patients in a certain way. And with my restorative hygiene background, I can also do certain things that other hygienists can't do. So I might get paid more than somebody else. So I did have to look into all of that. But what I found was a lot of offices have very low ball offers. I would be talking to an office to temp there and they would pretty much say, well, we pay hygienists $30 an hour. I'd be asking for $40 per hour to start. And they would say to me, oh, well, we don't even pay our most experienced hygienists that much. And I would say, okay, well, that's fine. Then I apologize, but this won't work out for us because I won't take $30 per hour. And then they would sometimes say, oh, okay, well, anyways. Or sometimes they would say, oh, well, would you take 35 or, 36? And I would stick to my $40 per hour. And this is when I first started. I actually make a little bit more now. So when I first started temping, that's how much I would ask for. But you have to give them a reason why, because some offices will say, oh, well, how come your rate's a little bit higher? If they tell you that they start off their hygienist at $30 per hour and you have 10 years experience, well, you should be making more. So let's just say that you say to them, well, I want to make 35 per hour. Be prepared to say why. And simply saying, well, because I have experience isn't good enough. Take it a step further and say, hey, you know what? I have 5 years experience. I love what I do. I am extremely loyal. Knock on wood, I don't call in sick often. I think I've been sick once the past 3 years, so you can depend on me. I have no problem taking shifts on short notice. I don't take a lot of holidays, just mention things that they want to hear, but also be honest. If you say that you're not sick ever, and then you call in sick your first week on the job, well, you know what? They're not going to be too happy with you, right? So be honest also. Now, for me, I said things like, well, I'm now a restorative dental hygienist. So if let's just say a patient comes in for their cleaning and they have a high spot, or they said, hey, I came in last week to get a filling done and my filling's pretty high. Well, I can easily take out the high-speed handpiece and then just make it lower for them, because that is what I can do. Not everybody can do that unless you are a restorative dental hygienist. So that makes me more, I guess, more wanted than some of the other ones out there, because I can save them time, I can save them money, because if I can do that in my chair, it takes like 2 seconds. That makes the patient happy. That makes the office happy because they don't have to book the patient to come back. That makes the patient happy because they don't have to come back, you know. So I will say things and I will offer such examples to show them, well, this is why you pay me the way I'm paid. I have 13 years experience. I love what I do. I tutor full time. So I'm constantly talking about oral health. I have no problem talking about, you know, crowns, bridges, implants, because this is what I do all day long. More importantly, though, I would always take it a step further and say, well, you know what? I'm a temp. I don't get paid holidays. I don't get paid sick days. I don't get, sometimes they don't take away any tax. So I end up paying more at the end of the year. So yes, this is why I make more than $40 per hour, because of this. You can hire somebody else who makes $30 per hour, but they get sick pay, they get holiday pay, they get taxes taken off. So they're technically paying them more, but you know, because they're not getting as much in return. But don't say that if you're not a temp hygienist. If you're looking for a full-time job, do not say, well, I don't want sick pay, this and this and this, because you want that stuff, okay? You want sick pay, you want paid holidays, you want, you know, all of that stuff. But I have decided to not have that so that I can pick and choose my own hours. But that's not ideal for most people. You know, I tutor full time, so I don't need the income. You probably need to work full time or part time. So don't say, well, I'll take less if I don't get, you know, like sick pay and you know, holiday pay. So don't say that. But does that make sense to everybody? Why it is a good idea to negotiate, because typically they will start you off lower, or at least asking if you will take something lower. And I just always say no. You know, this is my rate. I can work at other offices for that rate, so it's up to you. You know, take it or leave it. But I'm also in the position where I can do that. I don't have to work because I tutor full time, but I love to work. There are a lot of you out there who are saying, well, I'm not in the luxury of doing that. I have to work. So then you can't be as, you know, but it's still okay to negotiate. So please let me know if you need help, because I help tons of people with this, because I have no problem talking about money, no problem at all. So if you need help, let me know, and good luck, and don't accept less than what you are worth.